The following segment is sponsored by Optum Utah. In honor of Breast Cancer Awareness Month, Karina is here from Optum Utah to share the signs and symptoms you can look for and what we need to know. Welcome to the show, Karina.
Thank you. Glad to be here.
Of course, we are so happy to have you. Okay, what do women need to know about breast cancer?
So I think number one is the statistics. So over 46,000 women in the United States alone are diagnosed with breast cancer every year.
Wow.
Over 2,000 of those are cases in Utah alone. Breast cancer is the second most common diagnosed cancer in women. And in general, breast cancer is easily treatable if it's caught early. And so we're here to talk about the importance of screenings and staying up to date on your annual wellness exams.
Sure, okay, good to know. Now, are there risk factors to look for? What should we look for?
Yeah, several risk factors. So number one we think of is age. So breast cancer is most commonly diagnosed in women over the age of 50. We also look at important things like family history. So obviously if you have any close relatives who were diagnosed with breast cancer at an early age, you can possibly be eligible for early screenings.
Okay.
Any personal history of any other type of cancer increases your risk for breast cancer. And then other risk factors include, obesity, lack of physical activity, smoking, excessive alcohol use. All of those can increase your risk.
Okay, what symptoms should we look for?
The hard part about breast cancer is a lot of the times it's painless and completely symptom-free, which is why diagnostic, mammograms are so important, because mammograms are the most sensitive and specific screening tool we have for detection of early breast cancer.
Sure.
Meaning a mammogram is going to detect breast cancer far before any patient or any experienced provider could detect it on a physical exam. But if you are looking for symptoms, you're looking for any sort of new mass or lump in the breast tissue that is adhered to the breast wall, doesn't move freely with the breast tissue.
Okay.
Any discharge or blood from the nipple, any changes in the skin or the texture of the skin, redness, flaky skin. But again, all of those symptoms don't necessarily mean you have breast cancer. So if you have any of those, if you have any doubt in your mind, you should talk to your primary care provider about those.
Just important things to look out for. What do health professionals recommend regarding screenings? I feel like it's always changing. So what's up to date in screenings?
Yeah, and unfortunately, there's still some conflict in between some guidelines. So depending on if you're looking at the United States Task Force Preventative Services or the American Cancer Society. But personally, as a provider, all of my patients, I try to get them in for early screenings as early as age 40.
Okay.
And from then on, you can get mammograms annually. But again, it's so important to talk about your risk factors, your family history, and determine your need for more frequent screenings or even earlier screenings before the age of 40.
Okay, that makes sense. Where can we go for more information?
So definitely I recommend, number one, talking to your primary care provider, because they know you best. They know your family history. They know your medical history. So any questions that you have, you should direct that towards your annual your primary care.
Sure.
But also some resources include like the American Cancer Society, I think is a great option.
Okay, perfect. And Optum Utah, their website's the bottom of the screen if you want that information as well. Thank you. Such an important topic as we enter into Breast Cancer Awareness Month. We appreciate you, Karina. Great to see you.
Thank you for having me.